Since the pandemic hit at the start of spring, people have been paralyzed with fear, some avoiding hospitals in an effort to dodge this potentially deadly virus.
That means serious conditions and ailments have gone unchecked. But in tonight's Rebound Detroit, one health crisis that cannot wait is cancer. Aerin Leigh knows COVID-19 can kill, but her fear of dying of cancer is even greater. It nearly took her baby girl.
We have come so far. She had leukemia when she was 3 and she's 32 now.
Medical advances saved her daughter and Aerin too. Last October, doctors discovered cancer had invaded her abdomen.
My appendix burst, spilled toxins and cancer into my system and grew a 23-pound tumor.
The tumor removal came with a hysterectomy, but the cancer, stage 4, had already spread, and she needed a second surgery just as the COVID-19 pandemic hit.
Even in the scariest of times, like the pandemic we're in now, if they were willing to do my surgery, I was going to get it done.
Across the country, cancer screenings have been down 80 to 90%.
Cancer cannot wait. If we think that we can wait and think that the cancer will not progress or not put our patients in a more difficult position after waiting, then I think we're making a mistake.
Dr. Richard Berry is Chief of Surgical Oncology at Ascension, Michigan. He says hospitals are taking all precautions and following CDC guidelines to keep patients safe.
I really think that the hospital is actually one of the safest places to be. And when it comes to cancer, the risk of cancer progressing or the risk of cancer being diagnosed at a later stage is far more dangerous potentially than the risk of contracting COVID.
Aerin sought treatment at Ascension, Michigan, because Dr. Berry developed a program to treat advanced cancers of the abdomen like hers. It's called HIPEC.
HIPEC, or hyperthermic intraperitoneal chemotherapy. It's for different types of cancers that can spread into the abdominal cavity.
If possible, it's now done laparoscopically with small incisions.
Where we put in heated chemotherapy into the abdominal cavity through small incisions to treat the cancer that is spread throughout the abdominal cavity.
In May, Aerin not only received HIPEC, she was in and out of the hospital in record time, just 3 days. Is she considered cancer-free?
She is, and I think she continues to do well, and we will continue to watch her.
Her message?
Take care of yourself because nobody else is going to. You are your best advocate.
So here's the Rebound rundown. Cancer cannot wait, so get screened now. Hospitals are again doing other surgeries and taking all precautions to keep you and your loved ones safe. Dr. Berry of Ascension, Michigan says if you're still fearful about coming into the hospital for cancer screening, doctors will meet you virtually. No matter what, do not put your care on the back burner. It could make the difference between life and death.